And with that, I would like to bring on our CEO, Jeff Green, to talk a little bit about Cal nonprofits and some of the tax implications of HR 1. Take it away,
Okay.
Jeff.
Thanks so much, Robert, and welcome everyone. I'm delighted that everyone's joining us this morning. So by way of introduction, we have two fabulous, true experts in their field, and we're going to talk about the two biggest pieces of the impact of HR 1 on our social safety net, both on the health access side as well as the food access side. But before we do that, I'm going to just offer a few notes on the bigger superstructure of the bill and some thoughts on what that means from a tax policy perspective, because in fact, at its core, this was a tax bill, and some of you that lived through all of this early in the year remember that that was the driving force for those promoting it. So let's go to the next slide. Just a note about what we're doing here. As always, we are a tripartite mission. We are a policy and advocacy organization on behalf of the entirety of the nonprofit sector, doing our best to make sure that we advocate for policies that serve and support and do not harm our nonprofits of every shape and size, over 100,000 of us across California. Educational work like this, and we'll get right into that in just a moment, and then research and data. And I'm actually going to show some snapshots here in the next couple of minutes of some of our partners and friends who have done some good research on this bill and sort of the graphic representation of what it will likely mean for all of us in the US and in California in particular. On occasion, we do our own research, and I will note that we're in the middle, actually past the middle at this point, of our own causes count research. So the report that we first issued a decade ago, updated about 5 years ago, and now are in the midst of another expansion and update of causes count. So look for that full new report in the new year. And we really want to talk in those reports about the overall economic impact of the sector, as well as equity and inequalities within it, geographically, regionally, and by any other metrics. So with that, let's go ahead and I'll jump into some of these. So if we remember back to the debate on HR 1, AKA Big Beautiful Bill, AKA the Budget Reconciliation Act, we have to remember that above all, this was an attempt to extend and build on the tax cuts from the first Trump term, and this was, of course, the Tax Cuts and Jobs Act of 2017. And you'll note here that just by sheer size and scale, this particular piece comes from the Congressional Budget Office. It shows, and you can see that the reconciliation bill there at the bottom, basically, if you were to lay it alongside any of these massive budget or tax acts of the last decade, it outstrips them all, and by quite a bit. So I think it's important to remember just the sheer magnitude of what this bill would do, assuming it is now enacted and stays in place for the full duration. It is a massive deficit and debt driver. It is a massive tax bill, and it's a massive transfer of wealth from the poorest to the wealthiest in the United States. Let's go to the next one. Now, just to link it back to that original bill, which is now 7-8 years in the rearview mirror, there were some major impacts to the nonprofit sector, some of which were foreseen at the time, but certainly not all. And so having the benefit of hindsight and the actual track record since that 2017 act went into play, if you look from 2018 forward, you'll see that two big things happened. So the actual tax law dramatically reduced charitable giving as far as the number of households that give. And that, of course, has a number attached to it. So by the time we got 7-8 years out, American Enterprise Institute actually issued this report, which I'd encourage anyone interested to read. It was last summer that this came out. But it estimates that about 23 million fewer households itemized. Now, that's not always a bad thing insofar as that's because the incentive structure changed in that tax act, which meant that there was a deduction that was accessible to folks that did not itemize their taxes. And so that made it very simple. However, that also meant that the incentive to give and then itemize those gifts against your tax bill was reduced considerably. So when all was said and done, working both with the American Enterprise Institute's numbers and then the Lilly School, which of course does Giving USA every year, the estimate was those 23 million fewer itemizers resulted in about 20 billion fewer dollars given into the nonprofit sector. Now, we're at a moment where total annual giving in the United States is approaching 600 billion. So 20 billion real dollars, but still just a fraction of the overall. However, that's a real impact, and that's the measurement, the estimate that was done. Let's go to the next slide. So when we look at the actual effects of HR1, the current bill that we're going to discuss today, the tax implications are really very clear. So this is from the Yale Budget Lab, and it's looking at the quintile, so the 20% groupings of taxpayers. So bottom quintile, the bottom 20% of earners, the next, the middle, the fourth, and then the top quintile. You can see here that the revenue net to these individuals, and it's after tax transfer income. So this is looking at all the various benefits and tax provisions in the bill. You can see it's a massive wealth transfer. And this was very clear from the beginning that this would do a whole lot more for the wealthiest folks and a whole lot less for those at the bottom end of the income and asset scale. Let's take another look at that, maybe just with California here. And this was from the Institute on Taxation and Economic Policy. And they were simulating taxpayers in California starting this next year. So 2026, what would the average tax change be in the various income ranges? And you can see here they did the quintiles, but they also then took the top quintile and broke it out from the 15%, 4%, 1% wealthiest. And you can see here there's just a very clear pattern. That taxes for the bottom would essentially be flat, unaffected, maybe a small decrease of $100, but you range that all the way to the richest 1% of Californians, and it would be a $35,000 per taxpayer, per filer savings. So again, a massive transfer of wealth to the wealthiest. Let's go to the next slide. So the pieces that go into this, and this is a whole separate webinar, and we'll probably do this, but these are the 8 places where it has the greatest impact on giving, philanthropy, and actual nonprofit organizations themselves. And I'm just going to point out that a few of these things are new in the bill, and a few of them are building on long-standing components of our tax system, which of course is incredibly complex in the United States, as we all know. So the first, there's a universal charitable deduction now available. That is brand new, and that will probably have some of the same effect that the 2017 Tax Cuts and Jobs Act had, which is that for those at the lower end of the income scale, there won't be much of an incentive. The good news is there will be some savings in the tax bill, so that's a good thing, but it will probably have a disincentivizing effect. The 2 new floors are newer ideas in our tax system for givers. So the floor for itemizers, meaning any individual filers now, if you are not giving more than half of your taxable income, you don't get any deduction for that, even if you are an itemizer. So that is for folks that have usually some assets, maybe they're homeowners, maybe they have high incomes. And of course, that scale has been skewing over time. But what you have here is if you're not giving at least 0.5% equivalent away, you don't have any tax benefit. And there's an even higher floor for charitable gifts by businesses and corporations, and that's 1%. So 1% of after-tax income must be gifted before there is a tax benefit to that charitable gift. So those are the 3 new pieces, all of which are to some extent disincentivizers for giving, and we're going to see, of course, what is proven out over time. Number 4, there are increased standard deductions. So this is a long-standing piece of our tax code. It just moves the number up, which again, for individuals is good, and we'll see what kind of effect that has. Limits on itemized deductions. This is sort of a disincentive at the very top end of the scale. So those in the 37% income tax bracket, they would max out dollar for dollar benefit at the 35% bracket. So we can get into that another time. Estate and gift taxes, this makes permanent something that was done back in 2017, and it just really explodes the exclusion number, meaning that wealthier households can give much more money untaxed to the next generation or among family members. So it went from less than half of these numbers back in 2017 to 15 million for individuals, 30 million for couples, and now that is going to be permanent and indexed to the actual inflation rate. So that will continue to grow unless and until that is reversed. So this means that there is no incentive for the vast majority of wealthier individuals that have considerable assets to give to a nonprofit, say, rather than have a tax, because they can now give it and keep it in the family and build multi-generational wealth. College and university endowment tax, this is an increase on the largest endowments. So instead of the standard across-the-board tax, which was something like 1.39%, there are now at the highest levels a much higher tax for big universities. Now, this is only going to affect several dozen colleges and universities. We're talking about the very largest, but that is a new revenue. into the federal government. And then the last piece there is a tax actually on highly compensated nonprofit employees. And again, there's so few of these, but for those large organizations that have $1 million plus earners, there is a considerable excise tax on that. So these are all the little pieces that were in the bill that are directly targeted at the nonprofit sector. You may remember some of the debate about things like other taxation on foundations. They did not come to pass in the final bill, but we'll talk about these in the future. Just know that they are out there. Finally, for folks to really decode this, I want to shout out two of our colleagues, the National Council of Nonprofits, of which we are a member. They have a decoder, if you will, of the act and what it means for taxation within the nonprofit sector. That's the link you see there, which will be distributed later as well. And then finally, we have Independent Sector, our other primary national partner, and they have another tracker for the policy landscape that focuses on tax legislation. So this was a tax bill. These are some of the tax implications. But in the end, the way they tried to pay for a little bit of it, but you have to remember there was massive spending in other places in the bill, so it nowhere nearly pays for itself. But the argument made by those backing this bill was that they had to cut back on our social safety net. And of course, primarily in two places, and that's what we're going to spend the rest of our time talking about today. I do want to call out before I introduce our colleagues here, this is always haunting in the background for us in California. And in fact, yes, California is a donor state, meaning that we give more as a state in federal taxes than we receive back in services, even before cuts like this happen. So I just always want to put that out there to remember that there is incredible power in California because we are leaned on heavily by the federal government because of our massive size and our strong economy. And so this does come up from time to time about what leverage we might have against unfair and inequitable taxation practices. So we'll leave that for another time. And now I get to introduce our two experts around what is happening on the health side as well as the food access side. So first, we're going to bring up Janice Rocco, who's the Chief of Staff of the California Medical Association. And following Janice, we'll have Stacia Levenfeld, who is the CEO of California Association of Food Banks, to talk about the impacts to the SNAP cuts. Thank you both so much for being here, and I will pass the mic.
Good morning, everyone. Thank you, Jeff, and thanks very much to Cal Nonprofits for inviting me to be here with all of you this morning. As Jeff mentioned, although this bill was largely about tax cuts, the way that some of those tax cuts are funded are through the historic cuts to Medicaid and other healthcare programs. And while I realize that most of you are not in the healthcare field per se, you certainly serve populations that are going to be impacted by the health cuts that are in HR 1. So we can go to the first slide. And just to give you a little bit of an overview of what's coming, we're talking about $1 trillion in healthcare cuts over 10 years. I'll talk a little bit about things pre-HR 1 and then some of the cuts and the coverage losses, the new Medicaid eligibility requirements that will come into effect later, the caps on loans for those seeking higher education, the expiration of the Affordable Care Act enhanced premium tax credits that are what's part of the budget shutdown debate at the moment, the defunding of certain 501c3s as Medicaid providers by HR 1, and then some of the work ahead. I wanted to start back in March of 2010 and even a couple months before that in terms of the passage of the Affordable Care Act. That is was a bill at the time that had stalled in both in the House in particular. And so we were at a place in January of 2010 where it looked like the Affordable Care Act was not going to become law. But California played an instrumental role in the resurrection of what looked to be a dead bill, not only because Nancy Pelosi was Speaker and was the leader in terms of getting the ACA put forward, but because something happened in California that restarted the debate. In January of 2010, we saw news coverage of rate increases, health insurance premium increases in California by one of the major health insurers of up to 39% for folks who buy their coverage through the individual market. And the attention that that received was able to restart the debate on the ACA. And I put up here some of the major provisions that we talked about at the time that the ACA was under consideration, including, guarantee issue of coverage regardless of pre-existing conditions, the ability to stay on your parents' insurance until you turned age 26, the health exchange, which here is covered California, making sure that people were able to get preventative care without cost sharing, and a comprehensive benefit package through the essential health benefits package, no lifetime or annual limits on your coverage. The thing that got less discussion at the time than was warranted was the Medicaid expansion, the thing that's being attacked by HR 1 in part. And the Medicaid expansion represented 5 million Californians getting coverage who had been uninsured before. So that really was one of the biggest changes the ACA brought us, was the Medicaid expansion. We can go on to the next slide. Then in 2017, we had the attempt to repeal the Affordable Care Act. And I think it's worth pointing this out because back in 2017, we came close to repealing the whole thing. The attempt to repeal it was defeated in the Senate by 1 vote. If Senator McCain, who was the deciding vote, had voted yes, then we would have had Vice President Pence breaking the tie and having repealed the ACA back then, with all of the provisions that were on the previous slide, as well as others. And that bill, the estimates at the time were that if this bill had passed, we would have had 15 million more uninsured nationwide and 20% premium increases in the individual market. And you'll see as we go through this conversation today, HR 1 reflects a very similar reality. Next slide. So in terms of HR 1, some of the provisions went into effect right away, July 4th. Others are happening over time. Most of the $1 trillion in healthcare cuts are things that we will see later. Most of them have not yet begun. The organization I work for, the California Medical Association, strongly opposed the bill. We had email campaigns, visits to Congress members, both in DC and in their district offices, and a nationwide texting campaign to voters to have them call their legislators, because we understood the harm that would come with the passage of this law. Next slide. There are some things that would have been worse than what is in HR 1 in terms of healthcare. We don't have the permanent destruction of the Medicaid system. It is still an entitlement program. We don't have dramatic decreases to the states in funding by making this a block grant or per capita cap situation. We continue to have eligibility for the ACA expansion population, which, as I mentioned, is 5 million people in California alone. And there were not across the board cuts to the federal matching dollars. And although, as I'll talk about later, Planned Parenthood is defunded for 1 year as a Medicaid provider, the original intent was for that to be permanent. And then, as I said before, several of the provisions are delayed for a number of years, mostly for political reasons. It took 3.5 years to do all of the changes that were necessary to implement the Affordable Care Act, including setting up the exchange and changing all the health insurance policies. But HR 1 is, ripping away some of this pretty quickly. We can go to the next slide. We were already in a precarious situation in California and across the country in terms of where things stood before the passage of HR 1. We'd already seen in California some hospitals, particularly in rural communities, closing, some services in other hospitals that are no longer being provided, particularly maternity care. We see emergency rooms are overcrowded, hard to get in to see a specialist in particular. California, during its budget crisis, recently redirected billions of dollars in managed care organization taxes, which are healthcare funds, to non-healthcare purposes. And we've also seen that Medicaid has become an incredibly popular program throughout the nation. We saw that when we did polling when HR 1 was under consideration. We could look at the proposition that was on last November's ballot, Proposition 35, which put more funding into Medicaid and to providers. who serve the Medi-Cal population to stabilize that system, and 68% of voters supported it. And we saw very similar percentages across the country as we did polling in terms of those who are supportive of the Medicaid program, because if they're not on Medicaid themselves and have never been, they still have friends or family who are benefiting from the Medicaid program. We can go on to the next slide. So this gets into the cuts, the very severe cuts. And as I pointed out, with the bill that failed in 2017, at that time, there was an estimate of 15 million people losing coverage. Well, this is the same situation, although slightly different individuals. The 10-year estimate is that 15 million people will lose coverage nationwide, either Medicaid coverage or the individual market coverage purchased through the exchanges. And the work requirements, which I'll talk a little bit more about as we go on, the work requirements are going to cost many people their coverage, and not necessarily because they're not working. And we've got folks who are documented, who are here in this country legally, who might be human trafficking victims or refugees or asylees or some other non-citizens who will lose coverage next year. Others will lose premium tax credits through the exchange. And then the HR 1 includes provider tax cuts. What most states, 49 states, do is they put taxes on certain providers to raise the money that they use as their state match to draw down the federal matching funds. And there are cuts to the ability of states to be able to continue with their provider taxes as they've existed to date. And so what we're going to see is a lot more uninsured people, a lot more uncompensated care. The hospitals that are already teetering in terms of financial stability, and the clinics and the physician offices are going to have a lot more uncompensated care and find it more difficult to survive. And we're already seeing healthcare systems start laying off hundreds of people at a time, preparing for the cuts that are coming. So we're already in a situation where hospitals, which are often the largest provider or the largest employers in any given community, are starting to lay off staff. And in terms of next year, for 2026, there are estimates that the average premium increase, before you think about the premium subsidies that are potentially going away, that I'll talk about, the premium increases because of increased healthcare costs and tariffs and the like are 20% premium increases in the individual market, which is just huge. The ACA had gotten us away from having double-digit premium increases, but now under HR 1, we're back to that situation. We'll do the next slide. So the work requirements, a few states have tried work requirements for folks who are enrolled in Medicaid. This will be for ages 19 to 64. When other states have tried this, just a few of them have tried it, they found that the majority of people who lose coverage are actually eligible. They're actually working or in one of the exempt categories, but they are unable to manage to get the paperwork that they're required to do. In this instance, it will be every 6 months processed. So we're going to have some folks who are not in a position to work who will become ineligible, and we will have other folks who are working who do meet the requirements to stay on Medicaid who are going to lose their coverage anyway. And in California, I've seen various estimates, but a couple different sources, including the state, have said that we will have up to 3 million Californians who will lose coverage due to these work requirements. We can go to the next slide. I did want to mention, and this is not directly healthcare related, but it impacts folks in healthcare and outside of healthcare. One of the lesser known provisions of HR 1 is putting caps on loans that folks can take out to get a higher education. So under HR 1, far fewer people will be able to afford to get a 4-year college degree or to go on to graduate school. These caps are at a level that are much lower than what people often borrow in order to get their education. With the example of folks who are in medical school, it's closer to $250,000 to $300,000 that folks need to borrow in order to get their education. And so to have the caps that are being set at $500,000 for undergraduate or $200,000 for graduate schools, including medical schools, will mean that a lot of people who are interested in a higher education will simply find it's beyond their grasp. Now, I think it's important to know about all of these things in part because this one will go into effect in the middle of next year. But the more outcry there is about these provisions, the more likelihood is that we'll see changes before some of these things are implemented. We can go on to the next slide. So the current government shutdown at the federal level is in large part related to the coming expiration of the Affordable Care Act enhanced premium tax credits. Folks who are receiving those credits in 2025, who will lose them effective January 1st, unless the Congress passes a bill to extend them, on average in California, will see their premiums double. And because of that, we estimate that as many as 400,000 Californians may drop coverage because it will become unaffordable. And the folks who are most likely to drop coverage are the youngest among us. So obviously, Congress can still act, but people are going to be getting their premium notices for 2026 in the mail shortly. They're going into the mail in California this week. And open enrollment starts November 1st. So if people are shopping for coverage and see how expensive it's going to be next year, then we're likely to see a lot of people immediately start dropping their coverage. The amount of money involved in these enhanced premium tax credits in California for 2025 has been $2.1 billion in federal funding. And so to lose that will have a dramatic impact on families' ability to pay for their coverage, to keep their coverage, and we will see a lot of folks who become uninsured if these premium tax credits are not extended. We can go on to the next slide. So now this one, in my mind, is a very unusual situation that federal legislation would target a specific nonprofit organization, a 501c3. They put in the bill that you cannot be a Medicaid provider if you meet the definition of a prohibited entity. You need to be a 501c3, an essential community provider that's focused on family planning services, have received over $800,000 in Medicaid reimbursement in fiscal year 23, and you have to be an abortion provider. So Planned Parenthood is about the only entity in this country that meets that definition. They've certainly gone to court. And initially there was an injunction. The injunction is lifted at the moment, but there is ongoing court proceedings in the Planned Parenthood Federation of America lawsuit. And then our state attorney general and other state attorney generals are also litigating this matter to challenge the defunding of Planned Parenthood that has already led to closures of 5 clinics in California and will lead to the closure of more if it stays in effect. We can go into the next slide to give some of the prior slide to this one. Just to point out some of the impact of defunding a particular nonprofit in California. We're talking about 1.3 million patient visits because the overwhelming majority of the patients at Planned Parenthood are enrolled in Medicaid. The FQHCs in the state can't fully replace the services that Planned Parenthood provides when you've got 1 in 4 Californians having received services there. So this is going to have a dramatic impact. The state has put together some funding. They took some Proposition 35 money, $90 million there, and they've taken some other funding to try to keep the clinics open for the 1 year that they'll be defunded under HR 1. Other states have less ability to do that, but in California, we're trying very hard to keep them open. We can go to the next slide. This just gives you an overall sense of the cumulative impacts of HR 1 in the healthcare space, of folks losing coverage, of our ERs becoming more crowded, of folks without coverage having medical debt, how the insurance premiums are going to be increasing dramatically, the threat to hospitals and clinics and physician offices in terms of them being able to survive financially. And as I said, with healthcare facilities often being among the largest employers in a community, the ripple effect goes beyond healthcare. And our state has to pass a balanced budget every year, so we cannot absorb the tens of billions of dollars that California is going to lose under HR1 annually. We can go on to the next slide. So just to give you a little sense of things that we're continuing to work on, we want to make sure that there are changes to what's in HR1 related to the provider taxes that, as I mentioned, states use to draw down federal funding. There's over $6 billion in Proposition 35 funding for Medi-Cal and workforce issues for this calendar year, and another $6 billion next year. So we're working on the implementation of that. We are, fighting hard for the ACA enhanced premium tax credits to be extended. We're working with the State Department of Healthcare Access and Information because there is a $50 billion program in HR1 to put some funding into what they're calling a rural health transformation program. We will find out by the end of the year how much money California gets, but the formula is written in such a way that California is disadvantaged in terms of getting its fair share given our population and our the percentage, the millions of Californians who actually live in the rural communities, and because of the work requirements that will come into effect by the end of next year unless things change. We're starting to set up systems to assist with eligibility verification so that people can hold on to their healthcare coverage. I think that is it in terms of the slides, but thank you.
Great. Thank you so much, Janice. Really appreciate you walking us through some of the implications there. Next, I'd like to bring on our second panelist, Stacia Levenfeld from the California Association of Food Banks.
Thank you, Jeff. I'm grateful to be part of this conversation today. The Supplemental Nutrition Assistance Program, you can go to the first slide, is our country's first line of defense against hunger. SNAP, or CalFresh as we call it in California, helps more than 5.5 million people in California access food annually. 63% of SNAP recipients in California are children and elderly people. HR1 contradicts the federal government's decades-long commitment to fighting hunger by shifting billions of dollars in SNAP costs to states and reducing food assistance for millions of people. Essentially, the largest cut to SNAP in US history will not only increase hunger in our communities, but will also have a detrimental effect on employment and access to food, because SNAP allows individuals to purchase food in their local grocery store. And in a ripple effect, this loss of funding will disproportionately reduce sales in our neighborhood markets that serve low-income Californians. Staying on this slide, let's take a little bit of a look at the impact. Over 800,000 individuals in California are estimated to be impacted by SNAP changes in HR1. About half are at risk of losing their benefits entirely, and the other half will see a reduction to their benefit amounts, which already average only $6.24 per person per day. So not a whole lot, and that could be further reduced. It's important to note that even though the bill was signed on the 4th of July, the impact in our local communities will be unfolding in waves as different parts of the bill take effects at different times. If someone is currently on CalFresh, they will be contacted if and when these changes impact them. So it's important that we need to communicate that people read the mail from their county when they get it, as it could be notifying them of some upcoming changes to their CalFresh benefits. Before I continue, I want to note that my comments today focus on HR1 impacts, and they should not be confused with the governor's announcement yesterday that CalFresh benefits for November could be delayed if the president and Congress do not reach an agreement to open the federal government by October 23rd. That impact would impact all 5.5 million people currently enrolled in CalFresh. So let's take a look at eligibility changes. One of the changes in HR1 limits who is eligible for the program. CalFresh is currently available to low-income, lawfully present non-citizens, such as asylees, refugees, parolees, battered non-citizens, trafficking survivors, and some others. However, H.R. 1 removes eligibility for many humanitarian immigrants, limiting eligibility to only certainly lawfully present residents, Cuban or Haitian entrants, and individuals who reside in the U.S. in accordance with COFA, the Compact of Free Association Agreement, which is Pacific Island nations, the Federated States of Micronesia, the Republic of the Marshall Islands, and the Republic of Palau. An estimated 74,000 non-citizens will lose CalFresh eligibility because of these changes. CalFresh recipients are not impacted by these changes right now. I want to stress that. CDSS is still waiting for more guidance from the USDA and will release that information as it becomes available. Next slide. Another big change to SNAP due to H.R. 1 is that more CalFresh recipients will be subject to time limits, or what you may have heard of as the able-bodied adult without dependence rule. Today, no CalFresh recipient is subject to time limits. When someone is subject to time limits, they can only get CalFresh for 3 months in a 36-month period, unless they can prove that they meet certain work requirements or qualify for an exemption. This rule does not make people more able to work. It just makes them hungrier, which we know is already a barrier to working. We're waiting to learn from the California Department of Social Services when Californians will be subject to this rule. Once the time limit is in place, over 300,000 Californians will be newly subject to the rule and risk losing their benefits. It is important to note that under H.R. 1, it has exempted people from these rules if they're eligible for Indian Health Service. Let's jump to the next slide on changes to funding. In addition to making it more difficult for people to access CalFresh, H.R. 1 will significantly strain California's budget, both at the state and county levels. As a result, California will have to pay more to help run the CalFresh program, as well as pay for the food benefits. Currently, administrative funding for CalFresh is 50% funded by the state and 50% funded by the federal government. In California, the state-funded portion is split between the state and the counties. Administrative funding helps to pay for the state and county eligibility workers and staff, public benefit county call centers, CalFresh EBT cards, California's online application, and CalFresh outreach. Administrative cuts to H.R. 1 take effect next October. At that point, the federal government will contribute only 25% instead of their half. That means a year from now, the state's portion will increase from 35 to 52.5%, and counties will absorb an increase from 15 to 22.5%. But the biggest financial impact on CalFresh due to H.R. 1 is the shift in who pays for the CalFresh food benefits themselves. Currently, CalFresh benefits are 100% federally funded. Starting in October 2027, the state of California will have to pay a portion of the cost of these benefits based on its payment error rate, which is calculated based on the accuracy of issued benefits, whether they're overpaid or underpaid. This could cost our state up to $2.1 billion annually, depending on its error rate. CAFB, along with county, state advocates, and other stakeholders, is collaborating to find solutions to lower California's error rate as soon as possible. Additional changes to know about on our next slide. There have been some additional changes to SNAP based on H.R. 1 that I don't have time to cover today in their entirety, but you can visit CDSS's website. In Spanish and English, they have a FAQ page to learn more about the impacts of H.R. 1 on CalFresh recipients, and it continues to get updated as more information is available. And also, California Association of Food Banks has on our website more details regarding the changes to CalFresh. Next slide. National data shows that nearly 1/3 of SNAP recipients already visit a food bank because their benefits don't last an entire month. With thousands estimated to see a reduction or loss in SNAP benefits due to H.R. 1, more families are likely to rely on local services or other food assistance programs they may qualify for, such as WIC, to help them make it through the month. I'm sure you've already made the connection, but cuts to CalFresh are happening at the same time as funding is being reduced from Medicaid and several other programs that support the safety net, in addition to what we heard about layoffs that are already occurring in response to some of the changes included in HR 1. When families are forced to make trade-offs between healthcare, rent, childcare, and other critical expenses, we know that food loses out. It's also worth mentioning that when families lose CalFresh, they're also at risk of losing Sunbucks, the summer lunch program, if they're no longer Streamline certified and have to apply. Although I will note Sunbucks funding was not impacted by HR 1. But that means that food banks are likely to see new neighbors accessing their services or an increased need from those that are already visiting a food bank or community-based organization providing food services. California food banks are already serving 6 million people each month, with more than 800,000 individuals likely to see a reduction or complete loss in CalFresh benefits next year. Food banks expect to see a sharp increase in demand for food. For every meal a food bank provides, SNAP delivers 9. Food banks will be stretched thin as they work to replace the amount of food that households will lose because of these cuts to CalFresh. Food banks will be there to support those facing hunger, and we know that many other nonprofits will continue to be there to support families impacted by HR 1. We will also continue to advocate for mitigating the harm of HR 1 at the state level and to reverse those devastating cuts at the federal level, because we know that nothing can make up for eligibility and the financial loss that this will cause to CalFresh recipients. Finally, on the final slide, there's some good news. California is the first state to take early action in our budget to start mitigating the harm from HR 1. The governor and the legislature included over $123 million to support improving our error rate while balancing program access and investments to support the implementation of time limits. In addition, the state is investing $80 million for food banks to purchase California grown and manufactured foods, a critical investment to feed our communities, but also an investment in our local economies. We look forward to working with the governor, the legislature, and advocates across the state to mitigate harm to families impacted by HR 1. Thank you.
Thank you so much, Stacia, for running us through the impacts there to CalFresh and SNAP. I'd like to invite our panelists back on. We do now have some time for some question and answers. And there are a few questions that are in the Q&A box that I would like to bring up. The first of which, and I'll invite Janice and Jeff back on to join us as well. The first question I have is, if your coverage lapses because the paperwork isn't submitted due to work requirements, can you reapply? And I believe this question is referencing Medicaid or Medi-Cal.
Sure. And the answer to that question is, it depends somewhat on your status. For example, folks who have what the state refers to as unsatisfactory immigration status, folks who are undocumented, if you were to lose coverage due to the work requirements in the future, California is cutting off enrollment January 1st of 2026 to adults who are undocumented. And so if you were to lose coverage due to the work requirements, you would not be able to simply reapply unless state law changes. However, if you're not in that unsatisfactory immigration status population, yes, you can reapply for coverage. The coverage would not be retroactive for as long as it has been historically, because the federal rules have changed in that regard. Not all of the bad changes to healthcare right now are in HR 1. Some of them are in executive orders from the president.
Thanks for that, Janice. The second question that I have here comes from Mary, and Mary asks, what are your thoughts on the impact these changes will make with donors? Is it fair to assume that we could see shifts in donor giving from other areas to support healthcare and food supply cuts?
I will offer 2 cents and say yes. I think that when the push comes to shove moment on giving happens, social safety net gets focused on, and often to the detriment of other types of philanthropy. But I think we need to be really clear that there is no philanthropic strategy for filling the gap this size. In fact, all year was we were sitting with elected legislators in California that we heard the same from every member of both houses, every committee, just there is no general fund solution to the federal cuts, and that's true at the state. Now the state, as Stacia mentioned, has actually taken some action to help fill that, but it's not like the state is going to fully fill those holes, just the way that the numbers fall. And philanthropy, same. There's actually an example from, and Stacia, you may remember this, the last time there was a SNAP cut of, even proposed anywhere near this magnitude, a lot of the studies at that time, were probably going back now to 2017, 2018, probably the first Trump term, said, okay, what if we just emptied out the assets of the 20 largest funders in California? You still wouldn't have gotten close. So it's just an order of magnitude problem, and I think we need to be attentive and ready for that.
Thanks for that analysis, Jeff. The next question that I have is, for those who recently applied for CalFresh, will they automatically be turned away given all of these cuts? What does that scenario look like for folks who have just applied very recently?
No, no one will be turned away. And there are advocates across the state that can assist at various nonprofits who will be assisting people who need assistance to continue to apply. But you can always apply for CalFresh, and no one should be immediately turned away.
That's a great reminder. Thank you, Stacia.
Yeah.
Jessica asks, can you speak more about the work requirements and how nonprofit organizations can support these requirements?
Sure. So the work requirements are set to go into effect in December of 2026. There is something in the federal law that it would say that the HHS secretary nationally could extend that beyond December of 2026, because what we found in the few states that have done it in the past is it takes a long time to implement. It's going to be very costly to the state to implement. So it may go into effect just at the end of next year. It may not, but the work requirements are for those aged 19 to 64. You need to work 80 hours a month, which could be employment, which could be volunteer hours, so that to the extent that folks are having trouble finding employment, nonprofits can certainly help in terms of providing volunteer opportunities. And we're already seeing it within the healthcare community, folks trying to figure out how to assist connecting people, with part-time work or part-time volunteer opportunities in order to meet the work requirements when they set up, because it's going to take time to set up the system.
That makes a lot of sense. Thanks for the clarity there.
And the state, and for CalFresh benefits, we are still waiting for guidance from the state. We don't, nothing has been announced yet. We expect that, that the work requirements will come sometime next year. I just want to reinforce that for families across the state, they should continue to keep applying for CalFresh. As things evolve and change, people will be notified, and advocates on the ground in the communities can notify people of the work requirements as well if they have not previously applied for CalFresh benefits.
That's a great addition. Thank you. The next question is, are there resources to keep some of our federal taxes to support programs? And I assume this is referencing California as a donor state. Maybe Jeff, you could touch on that. Is there any recourse for us to keep some of our federal tax dollar to support our programs?
Well, I mean, historically, it's a political negotiating tool. There's no sense where California could do, for example, a full tax strike. Although the most radical edge of that conversation, that does come up, and I mean that in a good way. Like it's good leverage to remember that California gives more than it gets back. But that said, we have always come from the place that we believe in the taxation system, and we believe that is good redistributive mechanism to help those most in need all over the country, not just in California. So we bring it up just because the power of the state, sometimes we forget that there is considerable power in California. So the short answer is no, the state doesn't get to do that. But there are examples of where state leadership will use threats of changes to their own taxation system as pushback against federal proposals. But I don't see a solution like that being viable here, just my opinion. But I think it's good to remember the power that we do have economically as a state.
That makes sense. The next question we have is, will premiums through CalChoice also see a 20% increase next year?
So CalChoice, for those who don't know, is for where small businesses can purchase coverage, and not to my knowledge. And part of the reason why is the reason we're seeing the potential of 20% increases in the individual market is because the insurers believe that a lot of people are going to drop coverage in 2026, and they price their products with the assumption that most of the people who drop coverage will be among the healthiest folks who had health coverage, and that therefore their claims cost per person will, rise. And so then they price the premiums for those left in the individual market higher than they would have to if everybody was holding on to their coverage. So that's part of what's driving the premium increases. That's not all of it. So everybody will see premium increases, but we don't expect the 20% outside the individual market.
Right. Janice, I have one more question for you, and that is, how optimistic are you that advocacy efforts will move the needle on some of this in a positive direction?
Well, I'm an optimist, and part of the reason why I talked about the Affordable Care Act and how difficult it was to pass that, and that it was, public sentiment around the rate increases that ultimately drove a change that led the House to have sufficient votes to pass it, and the fact that the effort to repeal the ACA in 2017 was just by one vote. And when we saw HR 1 pass, it was again just by one vote. So every single member of Congress has the ability to have an impact on whether or not these things go into effect. And we know the balance of power in terms of those who supported and those who opposed HR 1 is, incredibly slim. Somebody posted in the chat the 9 members of the California delegation, the 9 Congress members who voted for HR 1. And so I do think that by being actively engaged in elections and paying attention to how folks have voted, there is the potential for change. And one of the reasons that so many of the provisions in HR 1 related to healthcare are delayed until December 2026 or beyond is because they're things that are very unpopular with the public. And so they wanted to have those things not start harming people in demonstrable ways where they felt it before they vote in November of 2026. So it's going to be a hard fight, but I do think that we can reverse some of this.
Excellent. Thank you so much.
Yeah.
And if I can,
yeah, please go ahead, Stacia.
if I could just jump in and say how extremely important I think advocacy is going to be over the next, coming months and years, because it is so incredibly important that we all, as nonprofits, I would venture to guess that many of the nonprofits across California are serving people who are food insecure. It's so incredibly prevalent in our communities, unfortunately. And I think, Jeff, you started to reference it earlier in the conversation, which is just the data to understand the impact of these changes is so incredibly critical. And so for each of us, California Association of Food Banks is really investing in looking at ways to track food insecurity. In California, we've been grappling it and aligning data sources to give us a better visibility to what hunger looks like. But as we start looking at where are we at today and how are these policies impacting our communities, I think I can't speak to optimism, but I think I would like to just convey critical importance to all of us that we stay engaged and diligent in watching these impacts as we work to, scale up and serve our communities.
Yeah, I would third that notion. And I think the other thing to remember is this is incredibly unpopular nationally, and always has been. And so when Janice spoke of that narrow margin, and both Stacia and Janice speak of the importance of advocacy, just remember it's not that far. It's not like we have to flip a third of representatives or something. It's just a matter of making sure that they hear loud and clear that this is not something that their own constituents support. I think that was one of the big strategies in California about someone posted the list of representatives that voted for the bill, David Valdeo in particular, because his district is so dependent on Medicaid, that it was sort of, he had once been pushed out of office and not unrelated to votes like this. So it is certainly doable, and I think that's always good to remember. I also wanted to say, it looks like Claire put into the chat a link to some more, if you really want to get in the weeds of how to use the tax power of California to push back against the federal government. That's one good resource there about what kind of actual strategies might be possible. If anyone wants to dive into that too.
Virginia has a question here, and she says, can someone speak about how even if the bill passes with bipartisan support, is there a feature that allows congressional leaders to peel back funding after the fact?
I will say I'm not aware. I'm not familiar with this. I mean, we've certainly seen in the last few months there are things that have been funded that President Trump has decided to hold on to the money for rather than spending it as the Congress appropriated it. But in terms of the Congress congressional leaders being able to hold on to funds and not spend them, I'm not aware of that process.
Yeah, it's just, we're in such a different, things that most of us probably would have said, yeah, that's not a thing just months ago or a couple of years ago. It's different now. I mean, the rescissions packages, the impoundment attempts, and of course, all those things are working their way through the courts. So hard to know where they land, but it's probably not bad advice for us to think more broadly strategically than we might have in a previous time.
Great. Well, seeing no other questions in the chat, I would like to invite our panelists back on for any final thoughts that they might have or messages that they feel like they'd like to underscore from their presentation.
I'll jump in and just start with, as I mentioned earlier in the conversation yesterday, the counties in the state received guidance that if a budget is not reached, if the shutdown doesn't end by the 23rd, SNAP or CalFresh benefits, I hope you by now know I'm using the terms interchangeably, could be delayed or will be delayed beginning November 1st. That is a tremendous impact if you start to think about what that means in our communities. Already, food banks are seeing increase in demand just from the shutdown. California has a very large presence of federal workers, especially military families. And so already food banks are feeling the stretch and the pinch of the shutdown. And on top of that, for people not to receive their CalFresh benefits beginning November 1st would just be an incredible impact on our community. So I would urge everyone to think about their local food bank. If you have the time to volunteer at a food bank, if you have the resources to donate to your local food bank, this is really a critical time in our communities. The state of California has done an incredible job making people aware that this could potentially happen, really helping to allow food banks to purchase more food locally to supply it to our communities. But I would just urge you to reach out to your local food bank, community food pantry, nonprofit organization with food services, because this will be a really critical time if a budget deal is not reached by the 23rd. Thank you, Jeff.
Great. And with that, I would like to extend a heartfelt thanks to both Janice and Stacia for spending the morning with us, unpacking some of these impacts and the broader implications that HR 1 has to our state. We're so thrilled that you could offer your expertise to our community and look forward to collaborating with you all in the future to support our joint efforts. I'd also like to thank all of our registrants for attending, for your thoughtful questions and comments in the chat. It's always wonderful to see everyone engaged with each other and interacting in a forum such as this.